Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I'm here with Dr. James Kelley, and I'm at the Medical Innovation Forum powered by Octane in Irvine, California. James, welcome to the show.
Thanks for having me. It's a pleasure to be here.
All right, I feel like we've seen each other at one or two events recently, am I right?
It's been quite the conference season so far, but it's great to see you at all of them. So.
Come on, man. Yeah. I'm learning day by day. My doctor knowledge, I'm getting a little bit better here,
Start asking you questions.
Yeah, sure. So what brings you to Octane's event today?
Yeah, so I've actually been coming to Octane for a very long time. I used to work with one of the accelerators down here that's affiliated with a lot of the health systems in Orange County. So I've known about Octane for years. I haven't been in a couple of years, but it's about time that I made it back into the innovation space. This is a great first look for me. So I get to see a lot of the newer upcoming technology. Obviously, as Chief Medical Officer for an AI company, it's nice to see what else is out there, to also see what my opportunities to pursue, partnerships, things like that. So it's a great conglomeration of a lot of the people I need to be talking to.
And tell us about the current company you're working with,
Sure,
so ViaMD.
So ViaMD is it's essentially an advanced clinical intelligence that helps clinicians with their entire workflow. It helps patients. It's more or less on the way it looks to patients. It's a chat bot that they engage with that will ask them interview questions at an expert clinical level to generate the medical history, which is the thing that most diagnoses come from. A really good clinical history can give you the right outcome more often than not. Clinicians are being really stressed with a lot of burden of administrative, and they have to see a lot of patients very quickly, and interview skills have declined over time, and it's just for a variety of reasons we're not there anymore. And as healthcare shifts towards being more practiced by nurses, PAs, et cetera, there's just a lot more pressure on the system. And we help elevate people's level of care, their insight ahead of time. We help the patient experience be better. Hopefully the diagnosis and outcomes will be better. We also just lower the burden of admin workflow on all practitioners throughout the whole system. So it's really designed by clinicians for clinicians to help restore medicine and give it back to the patient and the doctor relationship.
Now I know we're about to be ending the first day, so we have a whole nother day ahead of us tomorrow. But that being said, so far, what's been one of your favorite parts of the conference?
They just had the sort of a pitch session of 3 different early stage medical innovations, one of which is by a freshman engineering student in college. Very, very cool, all around neuro, trying to help patients get better data, make better outcomes decisions, because neuro's kind of lagging behind. So that was a lot of fun. They also just had a session with the former agent for all of the top NFL quarterbacks for the last several decades.
Wow.
So it's been really cool to hear what's coming down the pike in terms of neuro. They've had conferences about cardiology. This one seems to be more towards neuro. There's ophthalmology, things like that. So, but yeah, seeing the newest, latest fun stuff and where it is in the clinical pipeline and how it's starting to really feel like the future now. So
I think that's been one of my favorite parts too, like whether it was the longevity conferences or some of the what material that's been presented today. I'm feeling optimistic. I'm feeling good. Like there's some advances happening. I'm like, what? Like this is happening or what? Like it's fun to get out of for me to get out of my silo of what I see, like, or my echo chamber of knowledge that I currently have, and to be out here and to see these innovators.
That's exactly why. So I trained in medicine, and then I did an MBA in early stage medical innovation because I figured out we don't have the right tools in medicine. We need more. We need to be pushing that envelope, both in terms of the front end for diagnostics and measurements and wearables and things like that, but also interventions. But even more than that, the experience. Healthcare is the reason that integrative and functional medicine has sort of taken off, is because traditional Western medicine is not a great experience. So now that we're throwing technology at it to solve some of the problems that technology is really good at, that humans are really bad at, I think we're going to see a dramatic shift both in terms of outcomes, but also in the experience. It's going to be much more accessible. A lot of healthcare is going to move towards the home. It's going to be less of that that sterile hospital environment. We're going to obviously be sterile, but sterile in terms of how it feels. So I think the healthcare experience is going to change dramatically in the next decade for the better. So, we need it. Otherwise, the whole system is going to do fairly poorly if we don't innovate. But it's really cool to see that people are doing that.
So circling back to AI just for a moment here, what excites you in AI right now? Like what excites you overall?
It's a tricky field because it's right at the kind of the precipice where we had a big push for the last year. Everybody got maybe a little bit ahead of their skis, and some things got implemented that may not have been ready for prime time. And I was worried there was going to be a contraction and everybody's going to get scared about all AI. But what I think it's going to happen is it's going to weed out the people that are really good, and it's going to give a much clearer insight into where AI can make the biggest short-term impact and where we need to tune it up a little bit. But it really has been, I think the biggest change that I've seen is the attitude towards letting it help with medicine. People are less scared of it now. They trust it a little bit more. They can see the clear benefit and how it's going to revolutionize workflow throughout. Then there's a lot of different parts of medicine it can affect, but even just the low-hanging stuff about like checking you in faster. So stuff like that, that should be much more technological is finally getting there. So that's really exciting to me, is that that classic, the cheesy commercials, like there has to be a better way. And I feel like we're finally doing that, where you're no longer is it 2.5 hours to get checked in an urgent care. So so fingers crossed, everybody will have a better experience pretty soon. So that to me is the most exciting part.
I'm in for the better experience. I'm in. Final question, James. If somebody's listening or watching this, and if they want to follow your work or follow you social media, websites, or otherwise, how do they do that?
No, I don't have as much of a presence as I probably should, but I would say the company ViaMD is VIYAMD.com. If anybody wants to learn more about how we optimize workflow and patient experience and hopefully outcomes as well, go there, get in touch with us. And it's hard to find me on LinkedIn, so maybe one day I'll start a podcast.
All good. Hey, I'm
find
in
me
for
on
that.
here. This is the best place to be.
I'm in for that. And for everybody listening, just so you know, we'll put the links to the website in the show notes, so you can just click on it and head right on over. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. Each and every day we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way in your journey as well. So again, hit that subscribe or follow button. And James, again, thank you for coming on.
Thanks for having me. Absolute pleasure. See you at the next one.